Imagine post-treatment of a major surgery to have remote management of a heart disease using medical data from connected devices at home and even wearable devices such as the Apple Watch. Well, heart-centered health tech startup Tricog Health enables just this, and the company has recently closed an $8.5 million Series B2 fundraise. Let's connect with Dr. Charit Bhograj. He's the CEO and the founder of Tricog Health. Thank you so much for taking time out. I just want to understand exactly how this works, because this is a clear mesh of technology at its finest in the healthcare sector. So how exactly can someone utilize the app or the platform?
Thank you very much for having me on the show. And as all of us know, heart disease has become the burning issue. The number of media reports, our loved ones, pictures and videos on social media, people falling unconscious and having a cardiac arrest are only increasing. The importance of heart health cannot be dismissed as one of the leading concerns in our life. Heart disease is the largest killer of India. And what Tricog is doing is bringing the best of AI technology combined with wearable devices to ensure that our loved ones are monitored at home, so that data that comes from our heart, from wearable devices, is then fed into the world's best AI system that has been trained over 12 million patients to produce the most accurate diagnosis. And the objective of this is to identify those people who are at the highest risk of complications and prevent them from occurring. And that is the mission of Tricog, is to use technology and AI to help people save lives from heart disease.
Well, that's absolutely fantastic. Let's discuss the recent fundraise as well. Close to $8.5 million. There were some previous fundraising rounds as well that took place. How much have you raised so far? Any details on the kind of valuation that you're currently sitting at?
So we've been very fortunate to be partnering with some of the finest venture capital firms across, not just in India, but also from Japan. And these are people who understand the importance of the healthcare space. And as you know, this is one segment that is actually going to grow quite tremendously over the next couple of decades. This present round is being led by Sony Ventures, Sony Ventures, along with Omron Healthcare. Omron is the lead, and they are investing in the vision of Tricog and what it is built, so that we are able to take healthcare to home. And this is the reason why the positivity is there in the work that we do. Along with Omron and Sony, we have University of Tokyo Edge Capital UTech, Inventus, who have played an important role all throughout our funding journey.
That is absolutely fantastic. And, if you could stress a little bit more about, taking healthcare to home. What exactly is it that you're looking to do with the funds? How are you looking to expand? How are you looking to even raise more awareness?
You're absolutely right about the need and importance of healthcare at home. I'm a cardiologist, and that's what I've done for 20 years. And let me tell you that today in India, we have some of the finest cardiologists, but all of them work in large hospitals. What Tricog has done over the last decade is to be able to use technology so that we can bring the cardiologists and their expertise closer to home. And this is where I see the future of healthcare very, very clearly leading. Our problems, heart-related issues, start at home. And Tricog will be there at home in the form of a virtual cardiologist who will use wearable devices to monitor your well-being and that of your loved one, so that we can identify a problem before it occurs. And this is the goal and the mission of Tricog, to be able to predict, prevent, and preempt heart problems before they occur. And over the next decade, you will see that over 65% of all healthcare, which is today focused around the hospital, will move towards at home. So exciting decade of growth and opportunities for all of us building in the healthcare system.
So are you saying that, when you say you want to prevent any heart diseases or any scares and use the cardiologist's expertise beforehand, so is it a device that is worn? I mean, because everyone's leading, everyone only wakes up when the actual problem occurs. So how does this prevent that from happening?
Today, we live in perhaps the most exciting times for AI companies like Tricog. And the reason is as follows. First, that the technology exists where we are able to monitor the human heart remotely 24/7. Number two, that we have the cellular connectivity and the internet network that is able to transmit this data in real time. And third, the cloud-based services and computing power to run complex algorithms so that we can make sense of all of this data coming in and derive insights. So AI companies such as Tricog use this data to be able to find patterns which are not visible otherwise and identify those people at risk so that we can tell people, hey, the path that you're on is going to lead to a complication. Please go meet your doctor before that occurs. And that is the goal that we have to prevent and predict problems before they occur.
Wow. Okay. So got that, and my eyes practically popped out when you spoke about actually monitoring, the human heart remotely with the help of AI and with the help of tech. But now let's discuss financials then. And Dr. Bhograj, what is it that you're clocking in by way of your annual recurring revenue? How are you looking to grow that number? Do you have any numbers in mind internally?
So we're clocking in close to over $7 million of recurring revenue, and that is going to double by the next 12 months. And this is coming from Tricog working in not just in India, but also overseas. The Philippines, Malaysia are important markets across Southeast Asia, followed by our expansion across East Africa. And this is going to see a tremendous growth over the next 2 years. Our focus is also to bring the same services that we're providing to at home. And our partnership with Omron is a key component of our go-to-market strategy, where Omron devices, along with the Tricog service, will be available to everyone to be able to be used by their parents, by their loved ones, so that we can make sure that they are safe.
Okay, so how many labs, hospitals, clinics, diagnostic centers, etc. are you currently present in? What are the geographies that you cover?
So Tricog today is one of the largest AI companies focused on healthcare. We just finished screening our 12 millionth patient, and majority of that is from India. And our goal is to reach 100 million patients by the end of 2027. Now, our focus is in India, and today we have reached a scale where we are screening and helping over 1 million patients every quarter. And this is growing exponentially with each day. Our network of clinics, hospitals, and nursing homes, and there are close to 5,000 of them, exists across 2 continents, Asia and Africa, and that number is also rapidly increasing. Our goal going forward is, of course, to be in every home, may it be a patient after they get discharged from the hospital, or a person with multiple risk factors will be using devices such as the Omron device and Apple Watch, along with the Tricog service, so that we can monitor these people effectively.
Can you also give us a sense as to how many patients already have been screened, how many have been detected as serious heart patients so far via your technology?
I'm very proud that the team together have screened over 12 million patients over the last 8 years of our journey, and that number is doubling every 18 months. Today, we are at 5,000 centers across India, form the basis of an infrastructure that has created the largest virtual cardiology network, not just in the private side, but working alongside 5 state governments. We are reaching every single corner of India to put a virtual cardiologist so that heart disease can be detected early. For every 100 patients that we screen, 5 of these are critical patients who need urgent treatment and are referred via our care platform to the cath lab or treated via thrombolysis. And I'm very proud to be partnering with the Ministry of Health across different state governments to make this happen so that the people who need it the most have the access of the best of cardiology right at their doorstep. Every day, about 15,000 to 20,000 patients are screened by Tricog and helped across today 14 different countries.
All right. So finally, I just want to understand then how you even take time out, Dr. Bhograj, to run a company and be a cardiologist.
Well, if you're really enjoying the work that you do, and that is what motivates all of us. People ask me, hey, don't you miss going to the cath lab and doing multiple procedures? Well, the answer is yes, a little bit. But as a cardiologist, I could have helped one person at a time. And today, this fantastic team of 280 people are helping 15,000 patients every single day. So we have another 88 million more patients to help. And that is what keeps all of us motivated every single day.
Spoken like a true entrepreneur. Thank you so much for taking time out, and good to get in, perspective as to really how you're looking to enable really preventing heart disease, which, as you said, is ever so prevalent world over.
Thank you very much for having me on your show.
Well, that's